Good day! Welcome to our case presentation. We are Group 1. I am Christine Joyce Valencia, together with my groupmates Monica Bailon, Chanel Belen, Gia Maureen Sulit, and Angela Shaira Tesico. The content of our case presentation includes the following. First, the patient history. Test ordered. Test result values, correlation and analysis, conclusion and medtech realization, and references. For the patient's history, an 18-year-old female living in Canada was hospitalized due to her prolonged bleeding following a dental procedure. She disclosed that excessive bleeding is not new to her as she suffers frequent epistaxis due to cold weather. She also added that she bruises easily and has experienced heavy menstrual bleeding since the first occurrence of menstruation. Pertinent history: had a knee injury at age of 9, required 2-week hospitalization to manage hemarthrosis. Hematuria at 12 years of age when no signs of renal illness were evident but revealed microhematuria in periodic routine analysis. She is the only child in the family and no member has the same or related history. Again, the patient's symptoms such as prolonged bleeding following a dental procedure, epistaxis, bruises easily, heavy menstrual bleeding, and hematuria all suggest a bleeding disorder.
The following tests were ordered to diagnose the disease of the patient. First is the activated partial thromboplastin time, which measured the clotting time of blood, evaluating the functioning of the intrinsic and common coagulation pathways. It is mainly used for managing heparin therapy and detecting clotting disorder. Second is the prothrombin time, which measured the clotting time through the extrinsic and common coagulation pathways. It assesses factors involved in clot formation and is used to monitor and adjust warfarin dosage. Next is the bleeding time. The bleeding time assesses platelet function and primary hemostasis by measuring the time it takes for bleeding to stop after a small incision or puncture. And next is platelet count, which measures the number of platelets in a given blood volume, important for clot formation. Low platelet count can cause bleeding issue, while high count may increase clotting risk. Next is factor VIII antigen, which measure the quantity of factor VIII. Deficiency or dysfunction can lead to hemophilia A. Next is factor VIII activity, which assesses the functional activity of factor VIII, measuring its participation in clotting. Lower activity is observed in individuals with hemophilia. Next is factor VIII ristocytine cofactor activity, which evaluates the interaction between factor VIII and von Willebrand factor, measuring factor VIII's ability to assist platelets in adhering to damaged vessels. Abnormal results indicate von Willebrand disease or other clotting disorder. And last is factor VIII von Willebrand factor multimer pattern, which analyzes the distribution and structure of von Willebrand factor multimers, aiding to diagnosing and classifying von Willebrand disease caused by deficiency or abnormalities in von Willebrand factor.
These are the following results of laboratory tests performed on the patient. First is the activated partial prothrombin time. The value of 70 seconds is prolonged compared to the normal range of 20 to 45 seconds. The prothrombin time value of 11.5 seconds falls within the normal range of 10 to 12 seconds. However, the bleeding time is prolonged with the result of 16 minutes, which is higher than the normal range of 2 to 9 minutes. The platelet count of 292,000 per microliter falls within the normal range. There may be a possible issue with the intrinsic pathway of the coagulation cascade as indicated by the elevated APTT. And the prolonged bleeding time may be attributed to impaired platelet function or other factors affecting clot formation. The low factor VIII antigen level of 31% suggests a reduced amount of of von Willebrand factor in the blood. This can lead to impaired platelet adhesion and factor VIII stabilization. Similarly, the low factor VIII activity level of 12% signifies a deficiency or dysfunction of factor VIII, which is crucial for the proper clotting. The reduced factor VIII ristocetin factor activity value is below the normal range with 6%, indicates a significant deficiency or dysfunction of factor VIII, impairing the ability to form blood clots. The presence of a low and intermediate molecular weight multimer pattern instead of the normal high and low molecular weight multimer in factor VIII von Willebrand multimer pattern suggests an abnormal distribution of von Willebrand factor multimers. Overall, these findings suggest a substantial impairment in blood clotting function, highlighting the potential presence of von Willebrand disease or hemophilia A.
For the correlation and analysis, the activated partial thromboplastin time is elevated, while the prothrombin time is within the normal value, which means that a possible problem is in the intrinsic coagulation pathway, including factors 12, 11, 9, and 8. But it is noted that the APTT is corrected using the adsorbed plasma, which will rule out the problem in factor 9 since it is absent in the adsorbed plasma, leaving factors 12, 11, and 8 as possible deficiencies. However, based on the symptoms, the patients suffer from bleeding and it is supported by the results in bleeding time, which is elevated. With this, we can rule out factor 12 because factor 12 is more on abnormal clotting rather than bleeding. We are now left with factors 11 and 8, which both deficiencies are related to hemophilia. And in hemophilia, the platelet count is normal, which is aligned with the results. However, the mentioned test results of hemophilia are the same as with the screening test results for von Willebrand disease, which shows elevated PTT, APTT, bleeding time, and normal PT and platelet count.
To continue, tests for factor VIII antigen, factor VIII activity, and factor VIII ristocetin cofactor activity are performed to determine whether the patient has hemophilia or von Willebrand disease because they differ from these tests. In hemophilia, these three tests are normal or slightly decreased. At the same time, in von Willebrand disease, these are typically decreased. Correlating this with the results shows that the disorder is von Willebrand disease because of the noticeably decreased results. Furthermore, factor VIII von Willebrand factor multimers are also performed, in which the absence of high molecular weight forms of multimers confirm the presence of one form of von Willebrand disease, which in this case is type 2.
Solution with the sign and condition of the patient, such as having dental-related bleeding, epistaxis, which she thought that is only due to cold weather, bruise easily, heavy menstrual bleeding since menarche, and history of hemarthrosis and hematuria when she was still young, along with the laboratory result of elevated APTT and bleeding time. And normal PT and platelet count help to deduce a bleeding disorder and possibility of hemophilia or von Willebrand disease. However, by the decreased result in factor VIII antigen, ristocetin cofactor activity, and multimer pattern, it is concluded that the patient had von Willebrand disease type 2. For medtech realization, medical technologies play a big part in the detection, prevention, and diagnosis of diseases. Those simple procedures that we do in school laboratories are not just simple as we think once we are in the real laboratory setting and once we practice our profession. Doing and analyzing this case study made us realize that we, as future medical technologists, are not allowed to make even a single mistake because someone's life is in our hands. Each laboratory test presented contributes in determining and diagnosing the disease. If a medical technology gives inaccurate result, this can already be the source of a big problem and loss of life. That is why we should always be responsible and mindful, starting now as students, so that once we are the one who are on the front line, we can save lives as much as we can by providing them with accurate, reliable laboratory results. The following slide is the list of preference. That's all. Thank you for listening. Again, we are the Group 1.